Welcome to Learning Anatomy with Dr. Bakari. Here we simplify anatomy and we also learn anatomy with so much fun. In this lecture, we'll be looking at the types of connective tissue that we have. I have done a previous lecture on the general configuration of connective tissue. If you've not checked that lecture out, please kindly go and do so. In that lecture, we described the components of the connective tissue. But for the purpose of this class, we would be focusing on the different types of connective tissue that we have, also highlighting the basis behind this classification. Before driving further to classify or highlight the types of connective tissue that we have, it is good for us to establish the basis onto which this classification is done. So for connective tissue to be classified into the different types that we have, the tissue composition is used as the basis onto which this classification is done. So we have the proportion and also the types of cell, fibers, and also grant substance are used as the basis onto classifying the different types of connective tissue. And we know that we have different types of cells. We also have different types of fibers, and we have different specifications of grant substances. We've tried to highlight this in our previous lecture on the connective tissue. So the types of the cells, fibers, and also grant substance are being used to establish the different types of connective tissue that we have. Also to add that the proportion of these structures are also used to establish the different types of connective tissues that we have. As we go through with this lecture, we would be seeing how different types of these structures and also their proportions are used to establish the different types of connective tissue that we have. Also to add that the organization of the extracellular matrix is also used to establish the different types of connective tissue that we have. So we have different patterns of arrangement of extracellular matrix. We know that the extracellular matrix is made up of fibers and grant substance. So the orientation of the fibers is also used as a basis for establishing the types of connective tissue that we have. So we have fibers that seem to be arranged parallel, and we have another set of fibers that are seen to be arranged in a meshwork network. So the different types of configuration that is highlighted here of the fibers, which of course is a structural component of the extracellular matrix, can also be used to stage the different types of connective tissue that we have. So it is good for us to highlight the basis behind this classification. So let's drive further to see the different types of connective tissue that we have. Connective tissue are divided into the connective tissue proper and also the specialized connective tissue. The connective tissue proper, this type of connective tissue represents the general configuration of connective tissue. If you go back to our lecture on the connective tissue, where we try to highlight the different structural components of the connective tissue, this connective tissue proper is seen to align with that kind of presentation. But for the specialized type of connective tissue, it means that they are distinct and different from the general orientation of connective tissue. So they are specialized and distinct based on their components and also the specificity that they exhibit. So the connective tissue proper is further subdivided into the loose connective tissue and also the dense connective tissue. The loose connective tissue means that the extracellular matrix is loosely packed. Going back to the structural component of the connective tissue, we say that we have cell and also the extracellular matrix. The cell is the cellular component of the connective tissue, while the extracellular components are the structures that are located outside the cellular environment. And the extracellular matrix is seen to be made up of fibers and also grant substance. So if we have the fibers within the grant substance that are loosely packed, which means that we have low population of fibers. This means that this type of connective tissue will be a loose type of connective tissue because it has a low density of extracellular matrix. If you go to the dense connective tissue type, it means that it has a high density of extracellular matrix, which means that the fibers are seen in high population, which means that this type of connective tissue will be densely packed. The two types of connective tissue proper that we have which can either be a loose type of connective tissue or a dense type of connective tissue. And we've tried to highlight the basis onto which this subdivision is done. This subdivision basically is done as a result of the density that is created within the extracellular matrix. So if you have low density of fibers, it means it's going to be a loose connective tissue. And if you have high density of fibers, it means it is going to be a dense connective tissue. So for the loose connective tissue can also be further subdivided into the areolar loose connective tissue. Then we have the adipose loose connective tissue. Then finally, we have the reticular loose connective tissue. This is a loose connective tissue types, and these types are so named based on the specificity that they also present. To the dense connective tissue, we also have some subdivisions. We have the dense regular connective tissue, we have the dense irregular connective tissue, then finally we have the elastic dense connective tissue. These are the three subdivisions of the dense connective tissue. We know that the dense connective tissue has a densely packed extracellular matrix. So you see that the different subdivisions of the dense connective tissue is characterized based on the arrangement of the extracellular matrix and also the specificity that they also present. Then finally, the second major subgroup of the connective tissue. Remember when we started with this slide, we said that the connective tissue can be connective tissue proper, which presents a general orientation, then the specialized connective tissue, which of course are distinct in their own configuration. For the specialized connective tissue, we have the supporting specialized connective tissue, and we have the fluid specialized connective tissue. For the supporting specialized connective tissue, we have the bone and the cartilage. Then for the fluid type of specialized connective tissue, we have the blood. So these are the subdivision of the specialized connective tissue. And you see that at the end, we have specific type of connective tissue falling under this specialized connective tissue. And this include the bone, the cartilage, and also the blood. We'll be dwelling more on this as we go through with this lecture. So let's go to the next slide where we'll be describing the general configuration of the connective tissue proper as it relates to being loose and also being dense. So first, let's go through the connective tissue proper, but we'll be focusing here on the loose type of connective tissue. This loose connective tissue is seen to have low density of loosely packed fibers. Remember, in our previous lecture, we stated that the connective tissue is made up of cellular components and also the extracellular matrix. Within the extracellular matrix, we have fibers and also ground substance. So if the fibers that is embedded within the ground substance is loosely packed, which means that the density of this fiber is low, it is going to be a loose type of connective tissue. This type of connective tissue basically are seen to be extensively distributed around the body. If you try to look at this configuration by the side, this is the histological presentation of a loose connective tissue. And at this point here is where we have the fiber. This fiber is what is harrowed here in black. If you look at the general orientation of the extracellular matrix, you see that the fibers are loosely packed with low density. So if you look at it, you see that you have just few strands of fibers within this ground substance. And if you look at this region, this is where we have the cellular component, and the region here that is harrowed in white is the ground substance onto which the fibers and the cells are embedded. So if you look at the general orientation, you see that it is loosely packed. So this is the kind of configuration that is seen of a loose connective tissue. And we said that this type of connective tissue basically are seen to connect structures or tissues together. In our previous lecture, when we try to describe the different types of fibers that we have, we say fibers basically are to give tensile strength or support to connective tissue. But if you look at this kind of connective tissue, you see that they have low density of fibers. And this is the structure that is supposed to be providing structural support. So because we have low density of fibers, this support will not be created by this type of connective tissue. The only thing that they do basically is to connect structures or tissues together. And this is understandable based on their structural orientation. So this loose connective tissue can further be subdivided into the areolar type of loose connective tissue. We have the adipose type of loose connective tissue, and we have the reticular type of loose connective tissue. We've tried to establish in our previous slide that this subdivisions are basically due to the specificity that they present, even though they already present a low density of loosely packed fibers, which of course represent a loose connective tissue. So for the areolar connective tissue, this is a true representation of a loose connective tissue. This is a general configuration of a loose connective tissue. And the characteristics include that they have collagen and also elastic fibers. You see it around the subcutaneous region, which is below the skin. You also see it in the lamina propria, which of course is seen to connect the epithelium lining with the muscular layer of organs within the body. You also see it between different organs, trying to connect these organs together. Remember, we already highlighted that the loose connective tissue basically are involved in connection because of their structural configuration, which does not give them the capacity to provide strength and also support. So what they do basically is to connect. So you see it at regions where connections are needed to be created. You also have the adipose type of connective tissue. This adipose type of connective tissue are seen to be spiced with adipocytes or fat cells. These cells are known to store fats, and what they do is to provide cushioning and also insulating effect. You see them around organs where they are tagged as visceral fats, and at this point they are referred to as visceral adipose tissue. This region, they help to cushion this organ and also help to keep them in place. You also have them in subcutaneous fatty tissue. This subcutaneous fatty layer are seen to help insulate the body. And also to add that the adipose loose connective tissue can be in form of the white adipose tissue, predominantly seen in adults. And this is the kind of configuration that they present, where you see a large reservoir of fats created within the cytoplasm. So you have just a single reservoir for fat created within the cytoplasm, where you have other cell organelles, of course, pushed to one side, so as to create the space for the storage of fat. Or you have it in form of brown adipose tissue. This brown adipose tissue is seen with adipocytes with multiple fat droplets. You try to compare it with the adipocyte that is seen in the white adipose tissue. You see that there's a large single reservoir for fats, while in the brown adipose tissue, the adipocytes are seen with multiple fat droplets. And this is what is presented here in this image. This is predominantly seen in fetus or in infants. Then the last type of loose connective tissue is the reticular connective tissue. And this, we should know by now that it will be spiced with reticular fibers. So when you see a loose configuration presented of a connective tissue, which means that we have low density of loosely packed fibers, and these fibers are reticular fibers. This type of configuration is seen to be a reticular type of loose connective tissue. And when you see this kind of presentation is in the lymph nodes, in the spleen, and also in the bone marrow. So you now have the different subtypes of loose connective tissue. And we already know our background or presentation of a loose connective tissue, which means that it have low density of loosely packed fibers. But you see that the different subdivisions that come under the loose connective tissue are as a result of the distinct presentation that they also present. Let's go to the dense connective tissue. The dense connective tissue is the second subdivision of the connective tissue proper. Remember, the connective tissue proper can be loose connective tissue or dense connective tissue. So for the dense connective tissue high density of fibers, just as the name implies, it is densely packed. So when you have extracellular matrix that is richly seen with extracellular fibers, it means that this type of connective tissue is a dense connective tissue. And what they do basically is to create support. We know that fibers are to give support and also tensile strength. And when they have high population of fibers, it means they would be able to also express this kind of function. So we have three subtypes of the dense connective tissue. We have the dense regular connective tissue, we have the dense irregular connective tissue, and we have the elastic dense connective tissue. So for the dense regular connective tissue, it means it is densely packed, but it has a regular orientation. So they have a specific pattern of arrangement whereby the fibers are arranged in parallel orientation. So if you try to use this image up here, if you look at this structure, this connective tissue, you see that the fibers follow a single direction. So they are well aligned. And the kind of tissue that you see this kind of presentation is in the tendons and also in the ligaments. Then the second type of the dense connective tissue, which is the dense irregular connective tissue. It is more like the opposite of the dense regular. It means that the fibers are irregularly arranged. So you see them creating a matchwork presentation. And if you try to use this image down here, this is the kind of presentation that is seen. You see that the fibers within the extracellular matrix are not arranged in parallel orientation. They are arranged in multiple directions. And this is why you see a kind of matchwork network that is created within the extracellular matrix. And where you see this kind of configuration is in the dermis of the skin. So you see that we have different patterns, even though they are densely packed. The high number of fibers can either be arranged parallel or be randomly arranged. So it depends on the configuration. This will determine how these connective tissues will be classified. The last one is the elastic connective tissue. From the name, we should know that this type of connective tissue, even though it is densely packed, it is seen with a high number of elastic fibers. So you have elastic fibrins deposited within this connective tissue. And where you see this kind of presentation is in the trachea, the vocal cords, and also some arterial walls. So these are the subdivisions that we have of a dense connective tissue. Let's go to the specialized type of connective tissue. We say that this type of connective tissue are not seen to have the general orientation of connective tissue. They are specialized because they have their distinct types of cells. They are distinct types of extracellular matrix. And this is why they are so classified as a specialized type of connective tissue. We have two types. We have the supporting specialized type of connective tissue, and we have the fluid specialized type of connective tissue. For the supporting specialized type of connective tissue, we have bone and we have cartilage. These two are examples of supporting specialized kind of connective tissue because they tend to create structural support for the body. For the bone, it is specifically distinct in its own way because it is seen to contain osteocytes. The osteocyte has a specialized type of cell that they contain. This osteocyte is not seen in any other type of connective tissue except bone, so it is peculiar to just bone. And also the ground substance of bone is ossified, and this is why you see that bone appears to be hard. So it is deposited with calcium salt, and this is why you have this solidification presented by bone. And this kind of configuration is peculiar to just bone. We also have the cartilage, where you have specialized type of cell referred to as chondrocytes. So you have chondrocytes also embedded within the extracellular matrix. The ground substance of cartilage also is in a semi-solid form, and this is why that it also presents some form of hardness, although not as hard as bone, but it also presents some form of hardness because of its semi-solid ground substance. Then finally, the fluid type of specialized connective tissue that we have is blood. The blood is also seen to be distinct in its own way. The ground substance of blood is specifically referred to as plasma, and this is distinct. And this is why it is classified under the specialized type of connective tissue. For a subsequent lecture, we'll be visiting each of these specialized type of connective tissue. So thanks for watching this video. Let's continue to keep up with this channel.